Hello, and welcome to the Health is the Key podcast, where we explore the health and wellness issues that matter to 1199 SEIU healthcare workers. I'm your host, Elizabeth Moore. Today, we're exploring an area of healthcare that you've probably been hearing a lot about in the news lately: lifestyle medicine. In a nutshell, it's defined as a team-based approach to healthcare that combines 6 pillars of health, including nutrition and restful sleep, to treat, reverse, and prevent chronic conditions like heart disease and obesity. So does that mean your doctor may soon be writing you a prescription for a healthy salad and a midday nap? Our guest today is especially equipped to answer that question. Dr. Hugo Ortega is an Associate Program Director for the Montefiore Einstein Internal Medicine Residency Program in the Bronx and has served on the American College of Lifestyle Medicine Board of Directors as Young Director. Welcome to Health is the Key, Dr. Ortega.
Thank you so much for having me.
So, we gave us a broad definition. Can you give us a little more detailed? What exactly is lifestyle medicine?
Yeah, definitely. So lifestyle medicine is relatively new. It is the evidence-based practice of lifestyle modifications and interventions in the 6 pillars of a healthy lifestyle. And the 6 pillars themselves are, 1, mostly whole food, plant-based diet, right? So that's like nutrition. There is routine or regular physical activity. That includes different types of physical activity, such as cardio and aerobic exercise, resistance training, flexibility, balance, etc. There is also a restorative sleep, ideally 7 to 9 hours, depending on what your needs are. There is avoiding risky substances, so avoiding drugs, alcohol, smoking, things that can harm your body. Positive social connections and maintaining them, a very important skill that sometimes people let flounder because they're focused on other aspects of their life, but is just as important as everything else. There is stress management, or resilience, as we say, where you can learn to deal with the stress of life and everything that comes at you and make sure it doesn't overwhelm you, cause anxiety, stress, other kind of mental health conditions.
And how did you first become involved with the American College of Lifestyle Medicine, and how did you personally become involved and incorporate this into your practice and teaching?
So I found out about it when I was going on my own personal health journey. When I was in my 3rd year of residency at Montefiore, I was, not feeling too good. I wanted to lose weight. I wanted to start eating healthier. At Montefiore, we have a couple of amazing physicians like Dr. Osfeld, who talks a lot about plant-based nutrition. And so I wanted to switch to this plant-based diet. I did this program called Plant-Powered Metro New York. It is a program where people can sign up and do a 2-week full-on intensive 100% whole food plant-based diet. You take your blood work before and after just to show how much of a difference you can get in 2 weeks. I did that program, made my switch to a plant-based diet, and during that program I asked, hey, how do I give resources to patients? I'm a doctor, I want to teach my patients about this. And so they gave me a bunch of websites, a bunch of amazing websites, and one of them was the American College of Lifestyle Medicine, so lifestylemedicine.org. When I searched through that website, like I'm prone to do, found out about a bunch of stuff, including the lifestyle medicine residency curriculum. So residents can get trained in lifestyle medicine during their training, which is great. And so I wanted to do that, but I was already graduating from residency. So when I moved to Northwell as a fellow in education, I brought that track there. And so by me getting to know the people at the College of Lifestyle Medicine, by starting the track at Northwell, that's how I kind of got involved. And then eventually that became the Young Director role, started doing stuff with the HEAL initiative, the health equity achieved through lifestyle medicine, and kind of that's how I am here today.
And you continue to be involved with the American College of Lifestyle Medicine, doing webinars?
Yeah, so most recently during the last annual conference, I was part of the final keynote panel, the Health Equity Achieved Through Lifestyle Medicine Diversity panel. We kind of spoke about how we can use this to try to mitigate the effects of, institutional and structural racism and all these things that affect our patients day to day, kind of talking about the importance of culture and how culture affects your lifestyle and how we need to try to navigate those waters in a way that is not just competent, but with the cultural humility, so that people can really try to understand how much goes into how they live their life and not just saying, hey, do this. It's okay, how do we do something for you that's better for you while acknowledging that you have all these things going on in the background.
One of the things I've read in particular about nutrition is that you're telling somebody who comes from a culture where you can no longer eat what you've eaten your whole life. And so how does that go over?
So that doesn't go over well usually, but that's also, I would say, a bad way of doing it because most people, I would say, if you go to more traditional, like cultural dining, right, no matter where it's from, whether it's like rural China, whether it's like South American, the more old school and rural and cultural the meal is, the more likely it is to be healthy. There is a lot of, beans, nuts and seeds, whole grains, fruits, vegetables, all those things are part of the cultural diet for almost every culture. Obviously, different places rely on certain food groups heavier, right? Like, South America might have a lot more maize and corn in their diet, and, like East Asia might have a lot of rice in their diet. But either way, if it's whole grains and if it's more traditional food, it tends to be a lot healthier. What kind of happens is as the food gets more westernized, and by westernized, I mean more processed, and especially as it gets ultra processed, that is usually where the problem happens in nutrition. As the culture gets more processed and that food becomes part of the culture, that's when we enter a problem, because now these foods that probably we shouldn't be eating on a routine basis start getting eaten on a routine basis, and it starts to develop all these chronic conditions.
Okay. And so we hear a lot about the whole food, plant-based. Is there no room for meat at all?
No. So even when I said it before for the 6 pillars, it is a mostly whole food plant-based diet. It doesn't mean you can't ever eat meat. It doesn't mean anything like that. It's not that restrictive. Obviously, the closer you get to 100% whole food plant-based, the healthier you tend to be, but that's not always the case. If you want to eat meat because it is culturally important to you, then you can. But it is more moderation and minimization rather than elimination. And so I actually focus a lot more with my patients on the addition of healthy food rather than the subtraction of unhealthy food. So I don't tell my patients, hey, you can't eat this. I always just tell my patients, add more to this. That's a lot easier pill to swallow, and it's a lot easier to make that change when it's like, okay, cool, I need to add some beans to my food. Or, okay, I just need to add, like an extra serving of like spinach or something, right? Like if you can just start to add the healthier stuff, you will also naturally start to crave the unhealthier stuff less. And so it just kind of fixes itself without me having to harp on not eating the bad stuff.
Right, the negative stuff. Yeah.
Exactly.
And of the 6 pillars, are they equal? Are one more important than the other, or do you focus on all 6?
They are all equally important. I would say we probably have the most research on nutrition just because it's been the most studied over the course of human history, I guess. But that doesn't mean that the other pillars aren't as important. It's just that they require more studies. That way we can give more evidence-based interventions and modifications. We do have some, right? Like I would say the stress resilient, the mindfulness, and like mindfulness-based stress reduction has exploded in terms of like the amount of research it has. And so the other pillars are starting to get more attention. And as they get more attention, we can study them better, we can give better interventions, and we can really give people a menu of options for how to improve their life rather than more, this is kind of what you need to do to be better.
Can you share some of that research, or personal stories that you have with your own patients?
Yeah, sure. So, I've worked with my patients on any of the pillars. Usually I'll ask my patients, like, what do you want to talk about? So, for example, last week I just had a patient who came in, kind of told me this story about how they've been losing so many members of their family due to age and sickness, and how it's just been really downing them. And, at first I was wondering if maybe there's like a missing social connection aspect, but it was more so just the stress and anxiety of having all the responsibility of taking care of those end-of-life demands on that person. And so we focused squarely on mindfulness-based stress reduction. I had her do a basic form of mindful breathing where you focus on the air going through your nose. I walked it through with her, sat in the room with her, had her do it for 5 minutes, and, she automatically felt better. But I explained to her that the reason I want her to focus on this is because we know that as people do mindfulness for at least 5 minutes a day, that they get physiologic changes in their brain. It starts to be more permanent.
And how receptive are patients to this? Or do they stick with it? What are some of the challenges you find that they come back to you and say, look, I just can't do this. I can't sit there and breathe for 5 minutes.
I know. I tell them, I'm like, hey, as little as that sounds like a commitment, it's hard. It's hard to sit and be with your body for 5 minutes because your body will try to say, what are you doing? We need to do something, right? Like your mind will run away and try to because it's like natural. It's a natural response. And so we're training that system to calm down. But usually what I find is that people say they need to actively implement it into their life. And if they're not purposeful about it and they don't like bake it into their day, then they let it fall to the wayside and it doesn't happen. And so usually what I work on with my patients is getting them to committing like full on a SMART goal, like specific, measurable, achievable, reasonable, and time bound with like follow up. Like come back in a month, we're going to talk about it, see how this went so that there's some accountability there. And then having them commit to it for that chunk of time, because I know if they do commit to it in that chunk of time, by the time they come back, they will say, oh, I feel a lot better. And once they realize that it's giving them actual change and progress, they'll keep going. And that doesn't matter if it's mindfulness, if it's dietary changes, whatever it is, as long as they make the changes, almost always they will say that they feel better. And then I use that motivation to keep running with it and to keep making more changes.
So earlier I joked about a prescription for diet and a nap. Do you actually write prescriptions? You know, I think in conventional medicine we've been told exercise, move more, get enough sleep. But do you give specifics?
I very specifically give prescriptions for all the pillars. I can give like nutrition prescriptions where I'm like, hey, you need to add, 2 to 3 servings of some sort of beans or legumes into your diet every day.
I was reading if one patient has a more significant health challenge, the dosage differs, so you will alter doses based on the individual patient.
Yes. The intensity of the lifestyle changes has to correspond to how sick the person is. The sicker you are, the more intense the lifestyle changes need to be to actually get progression. So someone who doesn't have diabetes and wants to prevent diabetes only needs to make mild lifestyle changes to prevent diabetes from happening. But someone who already has diabetes and has like high insulin requirements and is like very sick from the diabetes will need to make drastic changes in their lifestyle to at least treat it. And so usually what I tell to my patients, it's like, hey, it took years to build up these chronic conditions. It's going to take a while to reverse them. The more we do, the quicker we can start to reverse the damage that has been done to your body. But it depends on how much you're willing to change and over what time. And so some people are all in, and some people are slow baby steps. And either way works because eventually we get them to the same spot, right? And they've had different levels of the amount of change they were willing to do.
But the outcome was the same. So you, as their doctor, are leading them through this treatment program. What other kinds of support do they get at Montefiore? Are there programs that they can participate in?
Yes. Depending on what people need, there's always an interdisciplinary healthcare team, right? So we have registered dietitian, nutritionist, RDNs, right? We have like behavioral health, social work, psychiatry for like mental health issues. Basically, depending on their needs, they might need to talk to different people. And, as lifestyle medicine becomes more well-known and more popular and more gets budgeted towards it, I suspect that these ancillary services, these interdisciplinary members will become more prominent and will start to do more, and that will hopefully help everyone be better at the end.
And that's sort of what we've started with our Healthy Living Resource Center. We have these 5 channels: that's healthy minds, healthy body, healthy eating.
I've had really great personal stories with some of my patients, and those things are what kind of keep me motivated to keep doing it.
You had talked earlier about SMART, S-M-A-R-T. Can you go over that a little bit more? I'd love to hear more about that.
Yeah. SMART goals, SMART objectives, whatever you want to call them, is an acronym, like a lot of things are in medicine. But basically, every letter is something that you need to accomplish to make the goal more achievable and hopefully something that you can actually accomplish. And so the SMART stands for specific. So you need to say what exactly you want to do rather than just being vague about it. Like, hey, I want to exercise more, kind of vague.
I want to be healthier.
Yeah, it's like, hey, I want to eat 2 more servings of fruits and vegetables per day, like being specific, right? You need it to be measurable, meaning there needs to be some amount to it that you can measure. If it has a number attached to it, like I want to eat 1 extra serving of broccoli per day, now I can measure it. So now that 1 serving is my goal. And so now I can pay attention and I can check every day. It's like, did I hit the 1? No, right? There is achievable, right, in the sense that you want it to be realistic. You don't want
I'm
to
going to
be
eat
pie
10
in the
vegetables
sky,
a day.
right? You don't want to go. You don't want to go from only eating fast food because you don't have time for anything else to home cooking every meal, right? It's got to be a somewhat achievable transition. It has to be relevant, right? Ideally, the goal should be related to what your actual goals are, like your overall goals, like your life goals, your body goals, your lifestyle goals. And then the last one is very important, which is time bound. It needs to have some amount of time to it. Like there has to be a check-in period. And so it could be, I want to take a brisk walk 30 minutes a day for the next month, right? And so I can check at the end of the month, did I accomplish my goal? And so usually the way I kind of force the time-bound thing is by having my patients come back to see me. So that way I am the time for them. It's like, all right, come back in 8 weeks. We're going to see how you did.
And so you're sort of, in addition to being their physician, you're sort of their coach. You're helping them achieve these goals, reviewing them, making sure they still make sense.
Yes, that's an extremely important point. A lot of lifestyle behavior and modification change is related to coaching.
So as more people learn about lifestyle medicine, when a patient comes to you for an annual checkup, do you just treat all patients with lifestyle medicine? That's your approach now to doctoring.
I always try to implement lifestyle medicine in all of my visits, but I also, as a doctor, will treat them in the traditional medicine ways. Ideally, I want to merge them to the point where the more lifestyle changes we make, the less the traditional medicine is needed. And so usually the way I kind of tell my patients is, it's like, hey, you have these medical conditions, right? We're treating it currently with these medications, right? Or this surgery or whatever the procedures is. It's like, I want you to feel better, right? And while the medications are sort of a Band-Aid, right, the underlying problem isn't being fixed. And so the way to get at the underlying problem, at the root of the disease, is to really get at the root of the unhealthy lifestyle. And so if, while I'm treating the surface level stuff with the medications, I can start to treat the root cause of disease, the unhealthy lifestyle, then eventually we'll need less and less medications, like, because there'll just be less and less disease in the body. And so I always wanted to do both, but I always acknowledge that patients might not want to, right? And if the patient doesn't want to, yeah, I'll treat you
See
like
how
a doctor.
receptive
We'll do
they
whatever
are.
you want. Right? Some people don't want medicine and have the opposite issue where they're like, I don't want medicine. I'm like, I think you really need medicine. But, okay, I'll give it a shot. We'll do these changes. But if you don't want medicine and you need it, you need to be aggressive about these changes. And if you're not aggressive, I will talk to you about starting the medicines, and I'm not going to let that slide.
So
right?
it is a
So
merger.
I take both sides of the thing.
What kind of patients do you see in terms of age and the differences between each age group, the things they need to pay attention to or the things they don't have to worry about so much?
Yeah, I would say in terms of age-related differences in terms of lifestyle medicine care is that different people have different focuses at different times of their lives. And so they'll let some things be managed and well-controlled and some things they let fall to the wayside. And so, someone who is young and healthy likes exercising because it doesn't hurt them and they're able to do so. And so they're usually pretty okay in terms of like exercise as like a lifestyle pillar. But they might not be focused on things like maintaining social connections. That's why like loneliness is such a big deal in the younger generation right now, because they're so focused on other things and just try to stay afloat that they're letting these things fall to the wayside. As like people get older and they start to have more chronic conditions, they start to get more aware of their health and the importance of it, and so they might be more willing to make changes to like their food and just like start exercising more. Yet they might be ignoring how much this is affecting them mentally, and so they tend to let like the anxiety and the stress and the like behavioral health aspects fall to the wayside. And I'll have to focus with them. I'm like, hey, it's great that you're making these changes, but just looking at you, I could tell that you're like stressed out about this and like how it's affecting your health. So let's focus on you and try to help you relax, ease your mind, and to let that stress and anxiety actually leave. And then as they get older and they, the body gets a little more frail and a little bit weaker, and they get things like arthritis, people tend to not be as active anymore. And I work a lot with them on being more active, because being more active will minimize the pain, even though at the moment it might hurt. But in the long run, it does help a lot with these pains. And they also have special needs in terms of, like, if you follow the United States Physical Activity Guidelines, they recommend balance and flexibility training and exercise for people 65 and over.
And you had mentioned earlier about loneliness, particularly in this age group. The social isolation gets increased, and they are at home by themselves more, and losing that social connection affects their health in many ways.
Yeah. Loneliness amongst the elderly is extremely high. It is for a multitude of reasons. They're losing their family members, right? Friends will pass away, which is another big hit. There is retirement, so you lose your work friends, and you no longer have that standard social circle. And then some people, they also start to lose a sense of self and a sense of purpose, and they kind of isolate and self-withdraw. And so often I have to kind of work with them to get them to recognize that they're feeling lonely and to find some community to become a part of.
Mm-hmm.
And it's usually a community related to something of their interest. Like if you have a hobby, go to your local knitting club, right? Like if you're someone who likes to knit, right? Or it could be something as simple as go to the adult day center or one of the local community health centers or even the park and just start hanging out and making friends.
Mm-hmm.
And the more people do that, the happier they'll go.
That's encouraging, because our 1199 retirees have a very close-knit community. Their motto is retired but active. And so they have chapter meetings they attend, and exercise classes like chorus, knitting, exercise, meditation. So they are really happy to gather together and live their motto, retired but active.
Yeah, that's great.
So do you see this as the future of medicine or a combination? Do you think the conventional and lifestyle medicine need to work hand in hand, or do you see this as the future of medicine? You seem very immersed in it, and you're a true believer, so I'm just interested in whether you think that this is going to be all-encompassing.
I think essentially what lifestyle medicine should be is the foundation of medicine, in the sense that if we have people live healthy lifestyles, the need for traditional medicine will decrease. It won't go away, right? You can't treat everything with lifestyle, right? And so the things that can't be treated with lifestyle, then yes, we should treat with medicine in the future. If we can get lifestyle medicine to be at the root of everything and make sure patients really take care of themselves, then they will have to suffer less. And so I tell my patients, I'm like, hey, if you could take care of yourself to the point you don't need me anymore, I am happy. If you put me out of a job, that is great.
That's your goal.
That is my goal with you, is to not need me.
That sounds very hopeful, and thank you so much for your overview on lifestyle medicine. I think our members can benefit from it, and it's great that it's available to them.
What I really want patients to know about lifestyle medicine is that it is focused on them. They are the ones who are going to make the changes, but they also need to know that also means that all the power and all the excitement and all the positive changes, it was all because of them. It's great if you had some help, but at the end of the day, you're the one that made the changes and you're the one that is reaping the benefits, and so you should be really proud of yourselves. And
That's
so
really powerful. That's amazing. Thank you so much again for your time. We were so happy to talk to you and learn all about this new, exciting approach to medicine.
Yeah, thank you so much for having me. Hopefully, this helps motivate some people, and if they're excited, there's plenty of resources for them to look up more about lifestyle medicine, start to learn about it, and hopefully find practicing lifestyle medicine professionals and physicians in the area and start to work with them.
That's great. Thanks so much. Tune in later this month to learn how Dr. Ortega uses a technique called motivational interviewing to help his patients take control of their health. For more information on what you heard today, please check our show notes. And remember, subscribe to Health is the Key wherever you get your podcasts. This podcast and its content are presented solely for general informational and entertainment purposes. The information and opinions provided on this podcast are not intended as legal or medical advice and do not constitute or serve as a substitute for professional medical or psychological treatment, diagnosis, therapy, or other types of professional intervention.